I love being here, not only to celebrate the 50th anniversary of this extraordinary organization, but also because it brings back very intense memories. A lot of you won't know this, but back in 1956, when I was a mere lad, wanting to know something about the way in which social democracy worked, I traveled to Saskatchewan and spent considerable time working first for the Saskatchewan Power Corporation and then for the Saskatchewan Social and Economic Planning Board, which was headed at the time, many people in this room will recall, by Tommy Shoyama. And I learned a great deal, and in 1956, as luck would have it, an election was called. And I begged Tommy to allow me to accompany him on the campaign trail, which he did. And I sat in the back of the car while he told those endless memorable stories and chuckled just often enough during the telling to invoke rapturous applause from the crowd. But of course, what I remember most, and I don't get many opportunities to share this, is that in the doctor strike of 1962, I actually came out to work in Saskatchewan during the strike. And interestingly enough, my job was to support, with the oversight of Stan Rands, the emergence of the community clinics, with which I was only marginally familiar, but absolutely fascinated in the schemata of delivering health care. And in the intervening 50 years, as has been said, Medicare has entrenched itself into the psyche and conscience of the Canadian people in a way which is irreversible. And very often when Canadians are asked to define themselves, they define themselves by the existence of public health insurance. And the observation that all of the surveys tend to show that 94% or more of the Canadian public approves of and wants public health insurance is a testament to Medicare and a testament to the enormous prescience and clairvoyance of the province and the tremendous ideological principle of both Tommy and Woodrow Lloyd in making sure that it happened. And now the feds are washing their hands of health care after 2014. The federal government has decided on a new formula. It's going to give money to the provinces. The provinces will do with it as they please. They're going to reduce the amount of money. They're not going to continue the 6% annual increase in the transfers to the provinces. And what it's going to amount to is the absolute dismantling of public health insurance. Don't kid yourself. We're going to see more and more privatization. We're going to see more and more user fees. We're going to see more and more a two-tier system emerge because of this outrageous ideological rigidity. It's as though the components of the American system should be transmitted to Canada somehow to teach us of the quintessential beauty of how healthcare is handled in the United States. So it's unsettling when your own federal government poses a real threat to Medicare, when Medicare is embraced by the entire population. Another example of what is so important about the preserving of Medicare and the enhancing and building on what we have in the future is, of course, the urgent need of a pharmacare program, a drug care program right across the country. I remember in Roy Romano's commission report that back in 2002 that he advocated for catastrophic drug coverage immediately, and then moving to full coverage for all of the illnesses that may beset humankind in Canada over time. And it's worth noting that we have the highest drug costs in the world, save the United States and Switzerland. These are political decisions which have to be made, and the political decisions we are now making at the federal level, supposedly protecting the Canada Health Act in the interests of Canadians, those decisions are running counter to what, for example, most people, I think, in this room would wish. And the first example of the perversity is the constant inclination to enter into new free trade agreements with a variety of organizations and countries around the world. And the primary purpose of the free trade agreements is to protect patents. That's why we're signing the agreements. And when you protect the patents, you're protecting the patents of the pharmaceutical industry. And what you're doing fundamentally is preventing the emergence of generic drug formulations that are exactly bioequivalent for the brand-named drugs, but are so much cheaper. I mean, people are still paying for HIV drugs in a number of jurisdictions. They're still paying $5,000, $10,000, $12,000 a year. We're now getting generic drugs from India for first-line interventions for HIV in Africa for around $100 per person per year. Not $5,000, $10,000, $12,000, but $100. For children, the treatment is now down to around $56 per child per year. I mean, yes, it's quite exciting, but it's because you have generic drugs, and these pharmaceutical companies are ravenously attempting to preserve their patent singularity in a way which will prevent the emergence of generics. And they're avaricious, and they're unbelievably powerful. They're the strongest lobby in the United States of America, and they're very, very wealthy. And they are now asking for extended patents in all of the free trade agreements, and we're giving it to them. This commission I sat on HIV and the law, the last section of our commission report was on accessibility to healthcare, and particularly to drugs. And we actually recommended, this by the way was a commission of 15 people from around the world, many of them really knowledgeable in the field. I don't want to pretend to it, but there were a lot of people who really understood the issues fully. And what we recommended around intellectual property rights was that there should be an absolute moratorium on any requests from the pharmaceutical industry for patent extension, and that the Secretary General of the United Nations was required to strike a high-level panel to completely redesign the intellectual property provisions of the World Trade Organization statute in order to protect the world from this ravenous behavior on the part of the drug companies. I don't understand it, that our government should be willing to nurture the richest multinationals in the world and give them privileges beyond the dreams of avarice is something I find very difficult to credit. And if you're looking for another example, as I am, of where the government has behaved in a fashion which flummoxes me, just take a look at the Canadian access to medicines regime. You'll recall that 8 years ago, the government of Canada agreed, under the then Prime Minister Paul Martin, that we would have a statute passed in the House of Commons which would allow Canada, as is entirely allowed under the intellectual property provisions internationally, that would allow Canada to manufacture antiretroviral drugs for export to African countries which desperately needed them. And they would go for children. They weren't even drugs designed for adults. They were formulations and regimens designed to keep children alive. There are over 2 million children on the planet living with HIV. There are around 300,000 who are born HIV positive every year. If they don't get drugs early, 50% of them die before the age of 2, 80% of them die before the age of 5. We had an opportunity as a country and a government to ship small portions of antiretroviral drugs to countries that asked for them. Rwanda asked for them, so we could keep children alive. And over the years, the interventions behind the scenes of the pharmaceutical industry, the feeling that the government had that it should protect the pharmaceutical industry for all its research and development in case they lost it by providing drugs at very cheap cost. The brand name drug companies under the legislation, they were getting royalties, for heaven's sakes. They were absolutely guaranteed that the drugs could not be sold in Canada or in the Western world at the prices they were being sold for in Africa. They were losing nothing, not a thing. And the vote came after the bill was amended in many ways, just last year. 26 Conservative members voted for the bill. because they were so taken with its objects. And then the government forced it to die in the Senate. And you have to ask yourself, what is going on here? What purview, what omniscience, what right have the pharmaceutical industry to dictate terms which can ultimately cause a loss of life? And why would the Canadian government be complicit in that? Well, there is some truth that health forms a larger percentage of budgets year on year, and that's, this is where I have trouble with math, of course, but even I understand that that's largely because they lower taxes. They lower taxes on people who can pay taxes. They lower taxes on corporations that can pay taxes. And they also cut back on realms like education and social services. So if you lower taxes, you have a smaller overall amount, and you cut back on other things, then health is going to assume a larger proportion of the budget. That's axiomatic. But what is not so axiomatic and rarely dealt with is the fact that as a percentage of gross domestic product, which is the way it's measured in every country of the world, Canada has been inching up incrementally. And we have, since 1975, varied roughly from 7% to 12% of GNP. And that puts us way behind the United States. It puts us roughly in the same realm as many of the European nations. The reason we've gone up more recently from 9% to 12%, frankly, is because of the amount of money that is being spent on private health coverage for drugs and for dentistry. There is a lot of private dental coverage because we should have a public dental plan as well, obviously, and there's a very large amount of money being spent on private drug coverage, and that buoys up the overall percentage of the GNP or of the GDP. And everybody's nervous about the budgetary implications of an aging population. Well, excellent economists have looked at that and noted that it couldn't possibly amount to more than 0.4 or 0.5% per year of GDP. So there's many ways of building in the cushions to any shock. And one of the way you build in the cushions, and I want everyone in this room to feel proud about it, is to recognize the model of the Saskatoon Community Clinic. Because when you talk about the future of Medicare, the model of the clinic should be inherent in that future. Because the model of building a team which encompasses all of the range of health practitioners, when you think of everything from nurse practitioners to counselors, and you don't have to have a doctor treat absolutely every patient, and you call on others, as is now being called on. You have psychiatric coverage at the West Side Clinic, which is coming from the university. I mean, it's amazing as they build in all of these partnerships. And you have a shared team engagement which ultimately lowers your costs. It's so interesting. And of course, when people are on salary rather than fee-for-service, that also lowers your cost. You have an overall maximum budget. So if you use the model evolved here in Saskatoon, it is less expensive. It reduces wait times. It would mean less pressure on emergency rooms because there would be alternative places for people to which to turn. There would be, I think, a more appropriate use of technologies, the various interventions and imagings which are done. And there would be much greater reverence for home care and long-term care than acute hospital care, taking pressure off hospital beds. There would be a kind of revolution in the way in which we look at health care in terms of promotion of good health and prevention of illness, rather than the abiding terms of this society, which relies so completely on fee-for-service and on hospitals and on acute interventions. And that's what makes the Saskatoon Community Clinic a kind of emblem of what's common sense in health. It isn't that we don't have examples around the country of how to improve health. It's that we never tie them together and see them as an ornate web of intelligence in rebuilding a system. So I'm really a convert to the Saskatoon Clinic model, which exists in 3 other places in the province.